Hello, my name is Bill Rowland and I'm the Director of the Family Medicine Residency at Munson Medical Center in Traverse City, Michigan. Thank you for your interest in our program, and we're hoping that this video will help answer some of the questions you may have as you go through the residency selection process. At Munson, we are a community-based residency affiliated with Michigan State University College of Osteopathic Medicine and College of Human Medicine. We're an 18-resident program and currently have 7 faculty, including myself. All faculty do full-spectrum medicine, including inpatient and obstetrics. The mission of our residency is to train you for rural practice in full-spectrum, comprehensive family medicine. This would include inpatient medicine, ambulatory medicine, of course, and obstetrics. Other areas of curriculum where we are strong include our global health curriculum, which has been ongoing for about 10 years with experience in Shagoria, Kenya, Africa. As I mentioned, obstetrics and inpatient medicine are strengths, and emergency department is as well. We have had graduates complete our program who are strictly hospitalists and other graduates who just do emergency department medicine. Other areas of curriculum that are emerging in our program include emphasis on community medicine and population health. In particular, we are starting a street medicine outreach program to work with the homeless population within northern Michigan. There has been a lot of emphasis on patient safety and quality over the years and building this into the curriculum, as well as wellness. We all understand the importance of us maintaining wellness throughout our career. So that's a bit about our residency. Now let's talk about Munson Medical Center. Munson Medical Center is a community hospital. It's a 400+ bed hospital, so it really works as more of a regional referral center for the northern lower Michigan, which is a population of about 500,000 people. Many students are concerned that if they come to more rural northern Michigan, they may miss out on pathology. That is absolutely not the case at Munson. As a 400-bed hospital, we have almost all subspecialties represented here, and the amount of pathology that we see is significant. You will not be at a loss of pathology. We have a regional OB service line, including a level 2 neonatal intensive care unit. Our trauma center is level 2 as well. And Munson is well known for the strength of their cardiovascular service line, which includes interventional cardiology and cardiothoracic surgery. As an unopposed residency, as a resident, you are pretty much one-on-one with all the attending physicians in these areas.
Well, I am Dr. Elizabeth Godfrey. I am a first-year resident here at Munson Family Practice Residency. Well, I'm standing in a trauma bay right now in our emergency department here at Munson Medical Center. We are the highest level acuity trauma center in the northern Michigan area. We are a level 2 trauma center. As family practice residents, we get to spend time in the emergency room not only on a dedicated rotation, but also when we are on night float, responding to traumas and codes, and when we are admitting our patients to our inpatient service. Because we are a level 2 trauma center and the highest level acuity trauma center in the northern Michigan area, we get a wide range of traumas that come in here. So it's very interesting and fun as a family practice resident to get to participate in those.
Hi there, my name's Rachel Hume. I'm one of the current second-year residents at the Munson Family Practice Residency. I'm originally from the downstate area from Farmington Hills, but I'm happy to be in Traverse City area. I am currently in the doctor's dictation area in the main hospital at Munson Medical Center. This is an area that's very important to our residency. It's one of the primary places that we spend time. It's a nice quiet area where there's computer access, and so we use this a lot on our service months, which as an intern you will spend a lot of time in here, and as a senior resident as well. There's computer access with quiet areas for dictation, and we do our evening sign-outs here as well.
Hi, I'm Adrianna Thibault. I'm a Munson Family Medicine resident. I'm a first-year intern. Recently moved up to Traverse City, always loved it, and I'm still loving it even more working here. So we are in the intern call room. We have a really comfy bed with a memory foam mattress, and we come in here when we're during the day kind of just hanging out in between patients, or if we need to work on notes, need a quiet space to work. We can also return calls. We have everything set up here. We also have a mini kitchen with our refrigerator and a full beverage selection. We have a coffee maker in here for us, and this is just a nice quiet space for us to kind of take a breather during the day. We also come in here at night. On the rare occasions you can take a breather from admissions during the night.
My name's Pyne. I'm a third-year family medicine resident here at Munson Medical Center. And despite being really busy and having sometimes big patient loads, one of the things we like to do is stop up here and admire the view of Traverse City.
My name is Miriam Reenster-Barman. I am one of the new family medicine interns here at Munson Medical Center. So as you can see, we are in this beautiful library that we have here at Munson. Residents use this library a lot for the resources that we get through the librarians and our literature library, especially helping us out with literature searches for projects and presentations and research. I've actually already done this as an intern, and the librarians are really helpful. They know a lot of tips and tricks for doing literature searches and can send you articles or find you books in here. This is also a really nice quiet space to work if you need to come and do some reading or work on some notes. The monitors here are really big too, so it's nice if you have something that you want to look at, like some imaging. This is our cafeteria. We have a lot of options here at the cafeteria, even during COVID, and even more before and hopefully after COVID someday. One of my favorite things about the cafeteria is they have an omelet bar every morning, which is amazing. And then there's also a Starbucks that's available all the time, not just in the mornings. For lunchtime, there's a wide variety of things to eat. We normally have a salad bar. Right now it's a variety of pre-made salads, everything from your traditional Caesar to like a taco salad. There's always sandwiches pre-made and to be made on the grill. There's always a grill option and soup. And then my favorite thing to have for lunch is the lunch special. They have really good lunch specials every weekday that you're here. Today it's a Mediterranean chicken salad wrap, which I'm definitely gonna go get right after this. So as residents here, we get a stipend for food. You get a card and you put it right on your badge. And then every time you need food, you just swipe the card and you get $2,000 for the whole year. And that goes a pretty long way in this cafeteria.
My name is Cynthia Wang, and I'm an intern here at Munson Medical Center. Right now I'm in labor and delivery of Munson Medical Center doing my OB rotation. We spend 2 months here during our intern year working directly with midwives and OBGYNs from the local OB groups. The skills that we learn during our intern year will help us later on when we start seeing OB patients our second year. Those patients come to our family practice clinic and we will help them through their pregnancy, eventually coming to deliver with them when they are full term.
Right now we are in the neonatal intensive care unit at the hospital. Our NICU here at Munson Medical Center is the only NICU in the northern lower peninsula. The next closest would be at DeVos down in Grand Rapids. It's a level 3 NICU here. And I would say an additional unique piece of our NICU here is that we do team rounding. So we invite parents to participate in the care of their babies. And I think it's a really nice team-based experience, and it feels very inclusive and encouraging for the parents. As far as opportunities for residents in the NICU go, as a second-year resident, we spend a 2-week rotation here. I'm currently rotating through the NICU right now, and I can say it's a wonderful rotation. I think it's a really valuable piece of our education we get as far as caring for, the littlest of humans goes.
My name is Natalie Cook. I'm one of the co-chief residents this year. I am from Southeast Michigan. We're currently in the ICU right now, which is one of our PGY2 rotations. So you spend 2 weeks up here. In addition to your ICU experience, you also round on your patients that are admitted to the ICU, just short of being intubated. Then the intensivist will take over. So in the ICU, any resident or any patient that is a patient of the family practice, you will admit them to the ICU, responsible for putting in all the orders, rounding on them every day. If there's any floor calls, it'll be your responsibility to come bedside and evaluate the patient. Most often, we see patients admitted here in DKA, so you get very comfortable managing things that are high acuity.
Hey, I'm Dr. Elfrink. I'm a second-year resident at Munson Family Practice. We're here in the Munson Medical Center simulation lab where we have these life-size adult and obstetric simulation dummies that we are able to run simulated patient experiences with that are anything from routine floor calls to codes to vaginal deliveries and obstetric emergencies. Yeah, having models like this is very important both for training now and in the future, because these are some situations where we want to be prepared before we come into the particular scenario with some idea of exactly what we would want to do and people that are going to be involved, and get the flow down before we are actually involved in a serious life or death situation.
Now that we've talked about Munson Medical Center, let's talk about Traverse City. Many people who do interview with us have not had much experience in northern Michigan or in Traverse City. Traverse City is a small town with big city amenities. The food scene, wineries, breweries, overall entertainment is significant given the size of our town. There's something in town called Interlochen Arts Academy, which does bring multi-faceted dance, music, theater, etc. to our town, which is something unique again for our size town. The outdoor recreation here is huge. We have 4 seasons, so you have to like snow, but if you're an outdoor enthusiast, we have every outdoor activity that you can imagine right at our fingertips and just outside our door. So the question is, why should you consider or choose the Family Medicine Residency at Munson Medical Center? As I said, we will train you to be excellent. Along the way, it's important for you to learn how to have balance in your life. There's no better place I can think of than Traverse City to be able to practice that and exercise that over the next 3 years. Residency training is challenging no matter what specialty you choose. But if you're going to take on that challenge, why not have a little bit of fun along the way?